Alzheimer's disease is a progressive neurodegenerative disorder affecting millions worldwide. Diagnosing Alzheimer's can be complex and often occurs late in the disease process. Early symptoms, such as memory loss and confusion, are frequently mistaken for normal aging. This delay in diagnosis can result in missed opportunities for early intervention. As the global population ages, the number of individuals with this disease is expected to rise. Early and accurate diagnosis is essential for timely and appropriate care. It helps in managing the disease and provides time to plan for the future. Early diagnosis allows for treatment strategies that may slow disease progression. Despite these benefits, diagnosing Alzheimer's remains a significant challenge. Traditionally, diagnosing Alzheimer's involves cognitive testing, brain imaging, and cerebrospinal fluid analysis. Cognitive tests assess memory and problem-solving skills but are not definitive for Alzheimer's. Brain imaging techniques provide detailed pictures of the brain's structure and function. These images can reveal changes like brain shrinkage and amyloid plaques. However, these methods are expensive and involve radiation exposure. Cerebrospinal fluid analysis measures beta amyloid and tau proteins but is invasive. These traditional methods have limitations that hinder early diagnosis. Blood-based biomarkers offer a non-invasive and accessible approach to diagnosing Alzheimer's disease. Unlike traditional methods, blood tests are relatively simple to perform and can be done in various healthcare settings. This makes them an attractive option for early detection and routine monitoring. One of the most significant advantages of blood-based biomarkers is their potential for early detection. They can identify biochemical changes associated with Alzheimer's long before clinical symptoms appear. This early detection can lead to timely intervention, potentially slowing disease progression and improving patient outcomes. The accessibility and cost-effectiveness of blood-based biomarkers also make them suitable for large-scale screening. They can be easily integrated into regular health checkups, ensuring broader reach and early identification. Another advantage is the repeatability of blood tests. The simplicity and convenience of blood-based biomarkers have the potential to transform Alzheimer's diagnosis. Two of the most promising blood-based biomarkers for Alzheimer's diagnosis are beta amyloid and tau proteins. These proteins are closely associated with the pathological changes in the brain seen in Alzheimer's disease. Beta amyloid is a protein that aggregates to form plaques in the brain, which are a hallmark of Alzheimer's. Elevated levels of beta amyloid in the blood can indicate early pathological changes in the brain. Recent advances in blood testing have made it possible to measure specific forms of beta amyloid with high accuracy, providing a reliable indicator of Alzheimer's. Tau proteins, on the other hand, form tangles inside neurons, another characteristic feature of Alzheimer's. Abnormal levels of tau in the blood can reflect neurodegeneration and disease progression. Blood tests can now measure different forms of tau, such as phosphorylated tau, which are more specifically associated with Alzheimer's pathology. Combining multiple biomarkers can enhance diagnostic accuracy and provide a more comprehensive understanding of the disease. Blood-based biomarkers have several applications beyond early detection. They can aid in differential diagnosis, distinguishing Alzheimer's from other types of dementia. This is crucial because different forms of dementia require different treatment approaches. Accurate diagnosis can ensure that patients receive the most appropriate care. These biomarkers are also valuable for monitoring disease progression. Regular blood tests can track changes in biomarker levels over time, providing insights into how the disease is evolving. Moreover, blood-based biomarkers can assess treatment response. They can indicate whether a patient is responding to a particular therapy, allowing for timely adjustments. In clinical trials, blood-based biomarkers can serve as endpoints to evaluate the efficacy of new therapies. This can accelerate the approval of effective treatments and bring them to patients sooner. Another exciting application is in preclinical detection, identifying individuals at risk of developing Alzheimer's before symptoms appear. Despite the promise of blood-based biomarkers, several challenges must be addressed to integrate them effectively into clinical practice. One major challenge is the standardization of biomarker assays. Consistent and reliable measurements are crucial for ensuring accurate diagnosis and monitoring. Validation of these biomarkers in diverse populations is also essential. Different demographic groups may have varying baseline levels of biomarkers, and these variations must be accounted for to avoid misdiagnosis. Large-scale studies are needed to establish reference ranges and validate the biomarker's diagnostic utility. Integrating blood-based biomarkers with other diagnostic tools is another challenge. Combining biomarkers with cognitive tests, imaging, and genetic data can enhance diagnostic accuracy, but requires sophisticated algorithms and analytical methods. Regulatory approval is another hurdle. Collaboration with regulatory bodies is essential to expedite this process. The integration of blood-based biomarkers into clinical practice holds tremendous promise for transforming Alzheimer's diagnosis and care. These biomarkers can streamline the diagnostic process, making it more accessible and less invasive. This can lead to earlier detection and intervention, improving patient outcomes significantly. In the future, routine blood tests could become a standard part of annual health checkups for older adults. This proactive approach can identify individuals at risk and initiate preventive measures early. Personalized medicine is another exciting prospect. Blood-based biomarkers can provide detailed insights into an individual's disease profile, enabling tailored treatment strategies. The integration of these biomarkers can also enhance clinical trials. Objective measures of disease progression and treatment response can streamline the evaluation of new therapies. As research continues to advance, these biomarkers are likely to become an integral part of Alzheimer's diagnosis and management. The introduction of blood-based biomarkers has the potential to significantly improve patient outcomes in Alzheimer's disease. Early and accurate diagnosis can lead to timely interventions that slow disease progression and alleviate symptoms. This can enhance the quality of life for patients and reduce the burden on caregivers. Early detection allows patients and families to plan for the future. They can make informed decisions about care, legal, and financial matters. Access to timely and appropriate treatment is another key benefit. Blood-based biomarkers can help identify the most effective therapies for each patient, optimizing treatment outcomes. Regular monitoring of disease progression can also improve patient outcomes. Frequent blood tests can track changes in biomarker levels, allowing for timely adjustments in treatment. Ultimately, the widespread adoption of blood-based biomarkers can lead to better health outcomes and improved quality of life for individuals living with Alzheimer's. The future of Alzheimer's diagnosis looks promising with the advent of blood-based biomarkers. These innovative tools offer a non-invasive, accessible, and cost-effective solution for early detection and monitoring of the disease. They hold the potential to revolutionize the way Alzheimer's is diagnosed and managed, providing new hope for patients and families. Ongoing research and technological advancements continue to enhance the accuracy and reliability of these biomarkers. As our understanding of Alzheimer's pathology deepens, new biomarkers are likely to emerge, further improving diagnostic capabilities. The integration of blood-based biomarkers into clinical practice will require collaboration and investment. Healthcare systems, researchers, and regulatory bodies must work together to overcome challenges and ensure that these tools are widely available. Public awareness and education initiatives can also play a crucial role in promoting early diagnosis and intervention. In conclusion, blood-based biomarkers represent a significant breakthrough in Alzheimer's diagnosis, offering a practical and efficient solution for early detection, personalized treatment, and improved patient outcomes. Visit our website for more information and to support Alzheimer's research. Together, we can make a difference.